I'm Syed Jafri, and I've been in gastroenterology practice for nearly 25 years. And one of my primary goal is to educate my patients, particularly on issues that are preventable. One disease close to my gut and heart is a preventable cancer, that is colorectal cancer. Colorectal cancer is a cancer that develops in the large intestine, that is the colon, as well as the rectum. An estimated 56,000 patients die, and an estimated 135,000 are diagnosed with this condition. Most, if not all, are preventable deaths. The reason for that is that you develop precancerous growths, which are called polyps, and this with time grows into cancer. Screening is a modality looking at the disease before the symptoms occur. So in other respects, before you have an identifiable cancer, you can look for growths. Common examples are doing a mammogram for breast cancer, a pap smear for cervical cancer, some blood tests for prostate cancer. In the same fashion, we have modalities that prevent colon cancer, either by some stool test, but more importantly, by looking at the lining of the colon, either by a colonoscopy, by optical means, or by virtual colonoscopy, which is a CT colography. This is a model of the large intestine. Here is your rectum, the left side of the colon, the mid part of the colon called transverse colon, and the right side of the colon that joins into the small bowel. It's approximately 6 feet, which we can assess by a colonoscopy or by CT colography. If you see these are small polyps, and this is a cancer. It takes an average 7 to 10 years between a small polyp growing into a cancer, and that is called as an adenoma carcinoma sequence. So our primary aim at colonoscopy is to find these adenomatous polyps before they grow into an adenocarcinoma, which is the cancer. Who is at risk for developing colorectal cancer? Both men and women above the age of 50 need to have colon cancer screening. Best test for that today is to have a full colonoscopy. In general, you develop polyps in your 40s, but if you have a family history, or if you have certain clinical conditions, your risk becomes higher. For example, if you have a first-degree relative, that is your parents, siblings, or children, and they have been diagnosed at, say, age 50, then your risk develops 10 years before at age 40. If you could remember when we talked about the adenoma carcinoma timing, it takes 7 to 10 years for these polyps to grow into cancer. So our main aim is to find those precancerous growths that are called as polyps before they become cancerous. If somebody has a hereditary reason for developing cancer, or if they have conditions like inflammatory bowel disease, for example, ulcerative colitis, they are at a higher risk for developing colon cancer. The main message is for you or your loved one, if you have never had a colonoscopy and you're above the age of 50, please call us or call any clinic that you would like to go to and have a colonoscopy as a screening tool for colon cancer.